But the less insurers spend on care, the more they have for potential profit. United Health managers pressed nurse practitioners to persuade Medicare Advantage members to change their code status to DNR, even when patients had clearly expressed a desire that all available treatments should be used to keep them alive. And they give the nursing homes bonuses if they refuse care to people. You know, we pay for it with our federal tax dollars. Overbilled us $185 billion. These incidents are hidden, downplayed, and minimized. The sense is, well, they're medically frail and no one lives forever. The top story over at theguardian.com right now is absolutely shocking. It's about United Health Group, the largest healthcare conglomerate in the world, or at least in the United States, I'm assuming in the world. And what they're finding, what they found, and this is a huge investigation. They said that it's based on thousands of confidential corporate and patient records obtained through sources, public records requests, court files, interviews with more than 20 current and former United Health and nursing home employees, and 2 whistleblower declarations submitted to Congress. So this is not just some rumor. This is, well sourced. And one of them pointed out, well, I'll just, this is a paragraph from it. They have this program, United Health has this program where they actually put the company's representatives in larger nursing homes to make sure that the residents don't get too much care, essentially. The way that they phrase it here on The Guardian is those secret bonuses have been, and they give the nursing homes bonuses if they refuse care to people. Those secret bonuses have been paid out as part of a United Health program that stations the company's own medical teams in nursing homes and pushes them to cut care expenses for residents covered by the insurance giant. In several cases identified by The Guardian, nursing home residents who needed immediate hospital care under the program failed to receive it after interventions from United Health staffers. At least one lived with permanent brain damage following his delayed transfer to a hospital. One of the United Health nurse practitioners who filed a whistleblower complaint with Congress said, "No one is truly investigating when a patient suffers harm. Absolutely no one. These incidents are hidden, downplayed, and minimized. The sense is, well, they're medically frail and no one lives forever." The Guardian goes on to note the company's successful effort to insert itself into the day-to-day operations of nearly 2,000 nursing homes in small towns and urban commercial strips across the nation has helped United Healthcare secure a vast stream of federal dollars from Medicare Advantage plans that cover more than 55,000 long-term nursing home residents. Now, here's the deal. With Medicare Advantage, you and I, the taxpayers, pay the insurance companies whether they spend money or not. With real Medicare, we only reimburse Medicare when Medicare pays a bill. In other words, you go get an MRI, and at that point, now there's a $2,000 bill that Medicare has to pay, and so the federal government gives Medicare $2,000. But if you are on Medicare Advantage, they can say, hey, he needs an MRI. Actually, they don't even say that. They get a flat sum, a lump sum of money for you based on a category of sickness that you fall into, which, by the way, gives them an incentive to what's called upcoding. You make it look like you're sicker than you are. And then that lump sum of money, they get to keep if they can prevent spending any of it. And, in fact, this is the point is made in the article. Under Medicare Advantage, insurers collect lump sums from the federal government to cover seniors' care, but the less insurers spend on care, the more they have for potential profit, an opportunity that United Health higher-ups have systematically sought to exploit when it comes to long-term nursing home residents. They talk about these do not resuscitate orders. Some people want to, hey, if I get really sick, just let me die. Other people, they want to be kept alive. And quoting, 2 current and 3 former United Health nurse practitioners told The Guardian that United Health managers pressed nurse practitioners to persuade Medicare Advantage members to change their code status to DNR, even when patients had clearly expressed a desire that all available treatments should be used to keep them alive. This is the Medicare Advantage scam on display. This is how it works. They, some estimates suggest that Medicare Advantage companies in total overbilled us, you and me, because we pay for it with our federal tax dollars, overbilled us to the tune of $185 billion last year. And of course, where does that go? It goes right to the bottom line of these companies. It goes to the multi-million-dollar bonuses that they pay their senior executives and their CEOs. It goes to the stockholders, and all this kind of stuff. So amazing. It's absolutely amazing.